We are continuing our discussion on the coronavirus or COVID-19 pandemic, and with new case numbers increasing again throughout the country and here in Orange County, we continue to record high numbers of new COVID cases, due mostly to the Delta variant. Many residents are questioning what we should do next. Orange County government is suggesting that all residents wear face masks again while indoors. So what does all of this mean for you? Well, on this special edition of Healthy Connections, we're going to get an up-to-date look at where we are as a community dealing with this pandemic. Let's get an update from our state medical professionals, and joining us is Alvina, epidemiologist with the Florida Department of Health in Orange County. Alvina, thank you so much for being with us today.
Thank you for having me again.
So Alvina, tell us where we are here in the county as well as in the state when it comes to COVID transmissions and the amount of cases that we have.
Well, currently we are unfortunately at a high rate of COVID transmission within our community. So if we look at the community measures, say that the CDC uses to sort of grade the counties on how they're doing, we're kind of all the way at red. So we are at almost 600 cases per 100,000 population, and the threshold for high risk or high amounts of transmission is at 100, greater than 100 cases per 100,000. And also recently, our 14-day percent positivity, the rolling average that we calculate, is just a hair above 20%. And so generally, after 10% positivity is what's considered to be a high rate of transmission. So there is a lot of COVID circulating in our community right now.
So what's behind this rise in numbers?
Well, so one thought is that it is due to the very contagious and very infectious Delta variant of the COVID-19 right now. So greater than 80% of all of the strains that are identified, or of all the sequences that are identified in Orange County residents, is due to the Delta variant. And Delta is currently the dominant strain circulating in the United States.
So talk about the Delta variant itself. What are the characteristics? When you say more contagious, what does that mean? Is there anything we can use as a guide to gauge that level of contagion?
Yeah, so the original strain, or the original COVID-19, it was thought to infect approximately, say, 1.5 to 2, maybe 3 people. So and currently the Delta variant is thought to infect probably up to like between 5 to 8 people. So one infected person can infect potentially another 5 to 8 people, and that would put it on par with chickenpox, essentially. One of the most contagious viruses that we have that infects humans is measles, and that has a sort of infectivity ratio of like 1 to 9. And so it is the Delta variant is at least 2 times more effective than the original strain.
And here in Orange County, we just ended the first week of classes for students. What would your report card be for that first week of school? How are schools doing?
So we've been working with the schools to put in as many protective layers as possible for all the pandemic precautions. And so, as many of the pandemic precautions that we can put upon each other in the school setting to protect those children who are not able to be vaccinated is what we've tried to do. We have obviously identified cases in school children and in staff, but that's part of the sort of ongoing transmission of what's happening within our communities. So what we see in the schools is reflective of what we see in the community as well.
And how are we doing with vaccinating the 12 to 17-year-olds so that they can be safer in school?
So over the past couple of weeks, so the last 2 weeks prior to school, we did see a slight increase in the number of first doses given to those children who are in the 12 to 17 age group. And so we're encouraged by that. We still have great vaccination rates in our 65 plus population, those who are the most vulnerable from severe illness and hospitalizations.
So the FDA just recently released information about approving booster shots for some individuals. Tell us about that.
Yes, so the third dose or the booster shot has been approved for those who have immune compromised, who are severely immune compromised. Persons who have received solid organ transplants. And so in conjunction with their healthcare provider, they may wish to discuss about what their immune levels are like with the two doses and potentially get the third dose to help boost that immunity in case they did not or weren't able to mount an adequate immune response previously with the two-dose series.
And Alvina, I want to get your take on what, as an epidemiologist, you see for the future. I know people have this pandemic fatigue, but where we are with the level of vaccinations and the variants, how does this sort of evolve, or how could it evolve in the future?
Well, we currently are at very high rates of transmission. We've surpassed pretty much the peaks that we had seen previously in the previous winter and summer. The difference between then and now is that we have the vaccines, which are still very effective at protecting us from severe outcomes, so hospitalization and death. And these are very effective right now. Potentially, as long as we have an unimmunized population where this virus predominantly spreads, I know breakthroughs get sort of the big headlines, but 98 to 99% of all cases that come in every day are in the unvaccinated population. So we previously talked about every new infection gives the virus a chance to mutate and potentially gain some kind of advantage that where it might be able to evade the natural immunity we've already built from the other strains, or to evade the vaccine-induced immunity that we've created. And so as long as that potential is there, there is this potential out there for a more infectious or more virulent or deadly strain to evolve. And so this is our push, and our race right now is, as we have this moment, this time period where we can get a handle and can try to control the spread of these infections to something where we can be able to keep up with the evolving strains.
So the bottom line is get vaccinated, basically.
That would be the best option, and as well as layering on the pandemic precautions. If you are going to be in, the spectrum of riskier places, outside's better than indoors. Indoors with a lot of people is riskier than, say, socially distanced in outdoors.
Well, Alvina, we always appreciate you keeping us informed from the front lines of this pandemic, as always. Thank you for being with us today.
Thank you for having me.
And we'll be right back with more. Stay with us. Let's continue our discussion with our local medical professionals, and joining us is Dr. Yolanda Martinez, manager of Orange County Health Services Department. And Dr. Martinez, thank you for being with us today.
Oh, thank you for inviting me.
So, Dr. Martinez, we were doing so well with the case numbers, with vaccine numbers, and suddenly it all seems to have fallen apart. What is behind this increase in new case numbers and hospitalizations that we're seeing?
Well, unfortunately, what you're saying is true, and there's only one thing behind it, and that is the Delta variant, unfortunately. As we know, and most of us have been hearing, it is definitely many more times more aggressive than the variants that we had seen before of the SARS-CoV-2 virus. So it has, I think, in many instances, if we think about it, it has taken a lot of people by surprise as to the real danger that it poses.
And a lot of those people being taken by surprise are those who are unvaccinated. So what should we be doing differently, those of us who are vaccinated and unvaccinated?
Yes, you're right. Unfortunately, it has affected mainly those individuals that are not vaccinated. And we go back to some of the same given in the past, and that is Exercising caution, wearing a mask does not hurt. On the contrary, it helps. It helps the individual wearing the mask, and it helps those individuals around as well. So personal protection, being very conscientious that you don't live in the world by yourself. You are surrounded by other individuals whose health and your health depend of that mutual um, uh, conversation of doing well and taking care of each other. So most importantly, uh, getting the vaccine if you're able, and that's something you need to speak with your doctor about. Make sure you consider very highly getting the vaccine. Secondly, wearing a mask. Wear the mask as often as you can when you're in public space, when you're among other people. Hygiene, wash your hands, and observe social distancing. So we're going back to some of the same recommendations that we gave the public at the pandemic and that worked so well for all of us. But now I think we have to be even more aggressive with all those recommendations.
And you know, here in Orange County, Barnett Park had really been the go-to place for both testing and vaccinations, and that's about to change. Tell us about that.
Well, Barnett Park remains the site for testing. We have moved our vaccination site over to Camping World Stadium. And the reason for that is that we have seen that some of the individuals that come for vaccines might have to wait in line a little bit, and we wanted to alleviate that situation. So by moving it to a site by itself, individuals just get there and the wait is not as long. And it's just dedicated for that. So now we have Barnett as the testing site, and we've added two other sites, the Econ Park over on the east side, and also what used to be the old Clark Cohen Elementary School over on the west side. So we have Barnett, which is more or less centrally located, one in the east and one in the west. And additional to that, the Camping World Stadium vaccination site.
And with those sites in mind, how do we ensure that all people who want to get vaccinated have access to the vaccinated, particularly in underserved communities? What's being done for that?
Well, one of the components that we're discussing today is with an organization, Lyft, to be able to get individuals that do not have transportation over to our testing site, to our vaccination site. So we're making the necessary arrangements to make it easy for individuals that do not have a vehicle, cannot drive, to get to the vaccination site and get vaccinated as well. So those are some of the options that we're doing. And of course, we're doing a lot of communications to let people know where we are and where they can come to us.
And here in Orange County, we are just about at the end of the first week of school being open for most students. How would you grade the first week of school here in Orange County?
Well, I know Orange County Public Schools has done a tremendous job in making sure the students and the staff are safe. They've been a tremendous partner, both with the efforts of the county and the community as a whole. So far, we haven't heard anything too terrible or too detrimental. I think everybody's playing their role the way they should, and people are wearing their masks when they need to. And the school certainly is making sure that the students and the staff are safe.
And I know that there, have been different mask recommendations coming from the CDC and here in Orange County, but and you sort of hinted on it before. What should we be doing about mask wearing in public spaces, particularly?
Well, put that mask on. So wear the mask, wear a protection, wear something that will prevent you from getting infected, and or if you're infected, from infecting others. So definitely the most important thing is to wear that protection, that barrier, when you go to the mall, when you go to the store, the grocery store, or when you're in meetings, or even inside of your own household. I think we have gotten to the point, and we had talked about this in some of the initial press conferences that we gave to the public, is even if you're at home with individuals that, if they're children less than 12 years old that have not been able to get vaccinated, or even the elderly, because we know now that even if the person is vaccinated, it is likely to get this variant, this Delta variant, if they're exposed to it, unfortunately. So wear the mask. Wear the mask as much as you can. It's not going to hurt you. On the contrary, it's going to help you and help those around you.
That's right. Even vaccinated people, the pandemic is not over.
It's not over. You're absolutely right. No.
Well, Dr. Martinez, thank you for being with us today. It's a pleasure speaking with you.
Thank you. The pleasure is mine. Thank you so much.
And we'll be right back with more. Stay with us. We've heard from a variety of leaders today trying to keep us informed about the coronavirus. From local government, the medical community who's on the front lines dealing with this pandemic, and organizations who continue to serve our community. And of course, we are also here to help you keep making those healthy connections. Stay safe.